Hello, everyone. Al Clancy again, Director of Training and Compliance with Health Plan Markets. I'd like to welcome you to session 3 of our 3-part series on beginning to work with duals. This 3-part series was constructed as a result of the notification that there was going to be the Medicaid Redetermination program that is starting now as we speak, and this could impact as many as 15 million Medicaid beneficiaries who are going to lose their Medicaid because of this redetermination. And so essentially everyone's going to have to go back through application process and vetting to make sure that they still in fact qualify for Medicaid. And this can really dramatically impact those beneficiaries who are dual beneficiaries, folks who have both Medicare and Medicaid. And many of you have dual beneficiaries who are on your book of business, and you want to make sure that you understand this process, and so that if necessary that you can step in, help translate some of this information and make sure that they get the information that is accurate. So the section today that we're going to talk to, this is number 3 out of 3 for these videos, and this particular one is going to focus on where to find these folks. So a lot of folks who are in the business, they have their favorite places, and they do a lot of tabletops. They do a lot of work with these folks on the dual space. But there may be a lot of folks who are fairly new. Maybe you took the certifications for the DSNP and the CSNP plans, but you don't necessarily really understand who they are, why they are. So the previous 2 videos will alert you of that information. But today we're going to talk a little bit about where to find them. So, there are really 4 different, concentrations of places where it's great for you to look as an agent, at least when you're starting out in the business. So the first one is to find them is you kind of have to know where they go. So you might jot these words down. Where do they live? Where do they shop? Where do they play? Where do they pray? Where do they work? So those are probably 5 of the most common that you'll see in these kind of programs. And carriers that offer DSNPs often have training classes on just this very thing, on how do you find these folks. So I don't think I'm going to say anything that's any different than they would say, but maybe you'll hear it just a little bit different. It might make a little difference to you. So where do they live? Where do they work? Where do they shop? Where do they play? Where do they pray? So, some of those things are, it seems kind of logical, but in many cases, you as the agent kind of have to go to them. They're not going to come to you. They probably aren't going to call you. They might not respond to you sending a piece of mail. If you do an ad in a local penny saver or newspaper, they might not call the number that's in there. So oftentimes you as the agent have to figure out how to get in front of them. So let's talk first about where they live. So, clearly there are some things, and this is kind of logical and reasonable, but there's low-income housing. And so there are many agents out there that do tabletops at low-income housing. I know that there have been some really creative things done at low-income housing units. And, in one instance, the carrier brought an ice cream truck. And so, but before they could get their coupon to get their ice cream, they had to wait in the little line. It wasn't a long line, but they had to wait in a little line to get their bag of goodies and to talk to the agent as the agent registered them for their attendance at the event. So it was a way to capture the information about the beneficiaries, and then secondarily for them to get the coupon to get their ice cream. And I will just say that particular agent on that particular day set up 4 appointments right from that table to go visit these beneficiaries in that low income housing unit immediately after the ice cream social was over. So meeting them where they are can be really important. So low income housing, of course, you have to get permission. You have to, you have to make sure that everything is on board. You just can't set up and put your card table up. But those are great places. So the second one would be where they work. So many of the folks that are dual eligible in Medicaid, they still have jobs. But what jobs do they have? If they're low income, I believe the income threshold right now is they can earn no more than $12,999 a year. I think that's the number. And if it's not, it's close. So when you think about that, you divide that by 12 months, roughly $1,000 a month. You divide that by 4 weeks in a month, again, roughly, that's $250 gross a week. So if they're working a 40-hour work week, they're earning $6 an hour. So this is really hard to make ends meet. So, working with these folks, in understanding where they work, what kind of jobs they have, they may not even be full-time, but these folks might very well be dual eligible and they're on Medicare and Medicaid, and they don't have this kind of plan. They may be still strictly on Medicaid, or they may be just on a Medicare Advantage plan. But when you open their eyes and show them everything that a dual plan can offer, if they're eligible, with a lot more benefits, a lot better copays, very, very rich additional benefits or ancillary benefits, then you can oftentimes win those folks over and get them to move on to that plan. So additionally, it's where they live, where they work, it's where they eat. Some great opportunities at setting up tabletops where they go to eat. Now, where do they eat? Are they going to eat at Ruth's Chris? Are they going to eat at some fancy is it Hillside or Hilltop up in Winter Park? Where are they going to go eat? They're most likely going to be going to a little diner, right? If they do go out, most of the time, because money's tight, they actually go grocery shopping and eat at home. But if they do go out someplace, they're going to go to someplace that's relatively affordable, and usually in many cases, within walking distance of their homes. So, understanding where the low-income housing is, and then driving around for, half an hour and marking down the names of some of the little restaurants that are around there, and maybe even going in and getting a cup of coffee and just looking and seeing who's there, and, kind of size the place up and see, okay, what if I could get, the owner of this little coffee shop would let me set up a tabletop from 6 in the morning till 8 in the morning, or from 7 to 9, or 8 to 10, or whatever the traffic is appropriate, and be there to offer some information to the customers about the programs. So where do they live? Where do they eat? Where do they shop? That's really important. So if they are low income, low asset, are they going to be spending their time at the Millennium Mall, or at some fancy, whatever city you're in, or close to, some fancy, very high-end stores, high-end mall with high-end stores? Maybe they get a gift card for their birthday or Christmas, or they've got a family member who's going to treat them. But based on their income and their assets, they're probably not going to frequent there. And if you've paid attention at all, you've seen a boatload of Dollar Generals popping up all over the place. Freestanding little Dollar General stores. So if it were me, I'd be kind of paying attention to where those Dollar General stores are. Why? Because the statistical chance is that Dollar General is using the income and asset demographics of that particular area to determine that this is a great place to set up shop. Dollar General is a little bit different than some of the competitors in that they do have a small food selection. They have a little bit of clothing. They have the necessities that people need, the paper goods and so forth. And so they have it truly is set up kind of like an old-fashioned general store where it has a little bit of everything. And that's why these are very popular and why they're popping up in these areas. So, kind of pay attention. Now, Dollar General is a corporate store. They might not allow you to set up a tabletop on the sidewalk in the front of their store. But if you find the area, that's what's important. And then you find the venue after that. And please use your market managers. These market managers are just absolutely, they're really good at what they do. And quite frankly, it doesn't matter what carrier they're with. Every single one of them that I have met is truly committed to helping you succeed. So I don't care who you're certified and appointed with, use those market managers. And many of the carriers actually have outreach folks that work with the dual and help set up events for the agents that are in areas where the duals kind of go. So we've talked about where they live, where they work, where they shop, and where do they play? So they play primarily. They look at their income and their assets. They can't afford season tickets to the Tampa Bay Buccaneers or to the Orlando Magic. They may have transportation issues, so it's hard for somebody landlocked in Lake County or Orange County to be able to get to the beach and play on the beach. So they play oftentimes at recreation facilities that are set up and structured in the low income, low asset communities. And so they get to have a chance to talk with other folks. It gives them a little bit of socialization, gives them a chance to play some games. Oftentimes these venues will have planned activities for them, and it really gives them a chance to get out away from the four walls of their house and their TV and really have some interaction. So those types of facilities are great places for tabletops and to really understand. Now, again, sometimes they're going to say no, and that's okay. But there are so many others opportunities out there. So just make sure that you're taking a look at the different places where they go. The last major one would be where they pray. So we've talked about where they live, where they work, where they shop, where they play. Last one's going to be where they pray. So churches and other faith-based organizations are very, very important, especially to the dual income folks. Probably a higher proportion of the low income folks. They take their faith very seriously. And so working with faith-based organizations to try to figure out how you can bring value to the parishioners or to the visitors, and really being able to verbalize that and communicate that effectively with the pastor or the director of senior activities or whomever it is at the church is really important. And oftentimes the carriers will help you with that. So if you figure out that company, I don't want to favor one over the other. So company Z has a great dual plan, and the market manager is really good and really nice, and they would be happy to perhaps schedule an appointment with you and the director or pastor to have a conversation about that. So, sometimes it requires a donation. So sometimes you might have to walk away because you don't know what's going to happen, and sometimes you can get partnerships to occur. So you can partner with a carrier or partner with a provider to help get you into that if there's a small fee to pay. So these are the kind of places where they go. Now, obviously, they do have to go to the doctor. So providers can be great resources. So when you're looking at providers, one of the questions that you might ask a provider group when they have a WebEx, for example, and you attend is, how do you handle, the dual folks, the low income, low assets, maybe that have transportation problems or that have a lot of medical issues? How do you handle them? And And if they say, that's kind of our our wheelhouse. We really enjoy working with those folks because we really believe that we can make a difference with those folks. And there are a couple of these doctor groups that have popped up in the Central Florida area recently, and these folks are really gearing themselves toward those low-income, low-asset communities and trying to get them access to care that they really, really need and will help them lead healthier lives. So the providers are great opportunities, and don't just think of primary care doctors as the providers. Think of the benefits that are in a dual plan. So they've got there's medical, but there's also dental. So you're looking at the in-network dentists that are part of that dental network, and go in and talk to them and see if you can. Maybe you don't set up a tabletop, but maybe you can leave a trifold brochure stand in there, or maybe you can have one day a month you can have the ability to go in there and chat with people, and or perhaps even educate the staff on what you do and how you help people. Sometimes that can really help on a lunch break. You can bring in a simple lunch and you can pay for lunch, if you will, and it might be a big ring sandwich from Publix and some bagged potato chips and a couple of 2 liters of Coke and Diet Coke or something, and you have a little in-house lunch, and you just kind of tell them a little bit what you do and ask them to just kind of keep their eyes open, and is there anybody that they think you might be able to help. So providers can really help with situations like that. Dentists, we just talked about dentists as well. Home health care agencies can also be a source of some referrals, and then looking at other opportunities like food pantries in the area, and volunteering for some of those types of organizations as well. And you can also look at Info USA. You can look at affordablehousingonline.com and find the low-income, low-asset housing. You can offer to do training classes in-house and so forth. So there's a lot of opportunities to be able to interact with these particular people. So that's where do they live, and the second one is what do you say to them? How do you talk to them? So you really have to make sure that you understand where they're coming from and what their background is, and you want to make sure that you're giving them the accurate information, really, because they get and this is very unfortunate, but they do get a lot of folks that attempt to take advantage of them. So make sure that you're giving them as much accurate information as you possibly can, and then also make sure that you're checking their Medicare eligibility and their Medicaid eligibility as well, and help with any of that you possibly can. So how do you enroll them? Well, you've the nice thing is that you can enroll face-to-face, and this is a population that probably might be best to do it face-to-face. And, of course, there's no call recording required with a face-to-face visit, but you can really learn an awful lot about them by doing that face-to-face enrollment, and learn a lot about them as people as well, what their likes are what their dislikes are, and how they, what's important to them. And what do they like, and this is where things can come in handy on the back end. So, if you walk in there and you see that they have a collection of lighthouses up on their cabinet, maybe they have 3, that's their collection, because they don't have a lot of disposable income. So, when you leave, you go to the Dollar General store, and for $1.25 plus tax, you'll probably find a calendar, 2023 calendar of lighthouses. And take the wrapper off. In the back page, it always has, on those big calendars, it always has a place for frequently called numbers. And of course, put your name on there. and you're, because you're number one, you know who their primary care doctor is. They gave it to you for the application. Put that name on there. Any other doctors that are really important. You want to put the member services number for the plan that they enrolled in there as well. And then you want to flip to their birth month. So if they were born on, fortunate enough to be born on St. Patrick's Day, go to March and choose March 17th and write happy birthday on there, and then close the calendar back up and then drop it back off at their house sometime over when you're back over in that area, and just say, hey, listen, I noticed that you like lighthouses, and I just thought you might like this calendar for the rest of 2023. And what's the first thing they're going to do? They're going to grab a glass of water or a glass of tea, and they're going to sit on the chair, and they're going to look at the pictures, right? And they're going to get to that March, and they're going to see that you wrote happy birthday. That is an incredible impact on that beneficiary. And when they get to the end and see that you already populated a lot of the most important numbers that they're going to need for their plan to run smoothly, that's really going to impact them as well. So this will conclude the presentation for today on where do they live, where do they shop, where do they play, where do they pray. How do you engage with them? How do you find them where they are? And how do you talk to them when you get there? Hope that you found this valuable, and we will see you on a future training class.